Good day, people. Today I'm going to answer what is a healthcare sharing ministry. Let's get to the punchline. This is how I cover my family's healthcare for $6,600 a year. So what is a healthcare sharing ministry? Too many syllables. I'm going to call it a health share for the rest of this video. Health shares are the cheapest and most flexible ways of covering your healthcare expenses in America. And by flexible, I mean there are no networks, and they are not attached to an employer or a lack of an employer. I'm going to start by contrasting it with health insurance, which I think most people have a good handle on. Alright, so in the case of health insurance, you got a large financial company, and they take in premiums from lots of people in exchange for agreeing to pay for any expenses as they occur. In the case of health insurance, you, or maybe your employer, they pay a monthly premium of, let's say, $1,000. Now they got loads of money from all those premiums, and you go to the doctor, and the health insurance company will pay for your doctor visit. There's also an annual deductible. Each year, you're going to have to pay for a good chunk of this yourself until you reach a threshold, and then they pay for the rest. Ideally, you're not paying that much for medicine because you're not going to need that much medicine. Most years, you are going to pay more money to your health insurance than you're going to get back. But the upside is the insurance is there to save you in the years your bills get really, really high. Now, as far as the company goes, the health insurance company, they take in all this money they have to pay out for medicine. They have to pay for their own organization to administer the whole thing. And they got money left over. They get to keep that for profit. A health share is not an insurance company. It's an organization that takes in monthly contributions that honestly look a lot like premiums. And it pays them out to members for medical expenses as they occur. So you have a bad day, go to the doctor, and the health share pays for your doctor visit. There's also an annual unshared amount, which looks a lot like a deductible. But you have some amount each year that you have to pay first before they start kicking money in. In a given year, if things go the way you want them to, you're not buying that much medicine, you actually pay more money into the health share than you take out. And then it protects you on those bad years where you get sick and have really, really high bills. So what about the health share itself? They bring in all this money, and they pay out for the medicine of their members. They also have to pay for their own administration. And like I said, they are significantly cheaper on average to the user. Why are they cheaper? What's different here? Oh, it's probably that pesky profit, right? The profit's an obvious structural difference. It's not an obvious cost difference. Health insurance companies, actually, because they get all those premiums and they put them in the bank, they can do financial transactions with those that make them a lot of money too. So they don't really have to make all their money just from, overcharging you. So how are these health shares cheaper? Let's start with what isn't covered. So they don't have to cover all the same things. Health shares, they usually follow the moral prescriptions of a religion. And they are not going to cover things that they consider immoral. So let's say, for instance, you went with a Catholic ministry. Well, no surprise here, but they're not going to pay for an abortion. Now, you might think, well, that's fine. I'll get this cheap healthcare thing, and I'll just pay for my abortions out of pocket. But not only do they not pay for the abortion, they don't pay for medical expenses for complications resulting from those things that they won't cover. So if you get an abortion and you pay out of pocket, not only do you have to pay for that, but you are also risking medical expenses if things go wrong that are not going to be covered by your health share. But we are just beginning. There's so many things they don't cover. So they don't cover expenses that result from gross negligent acts, illegal acts, self-inflicted acts, hazardous hobbies, alcohol or drugs. None of that is covered. And they also don't pay for stupid things that health insurance really has nothing to do with. Baldness, impotence, things like that. A couple things about this then. First of all, you better make sure that your values align with the health share, and if not your values, at least your behavior. Maybe you're not morally opposed to self-inflicted acts, but at least don't do them. But the other thing I do want to say, when you're shopping around for these things, they are extremely upfront about what they cover and don't cover. It's not, like 100-page small print legalese document spelling out what they won't cover. It is like a couple pages, plain English, really big font. They are extremely clear about what you are getting and what you're not getting with your health share coverage. Not only do they seem to not want to hide the ball, it seems like they're actually proud of what they do and don't cover. Don't fear that you're going to be surprised by it. But yeah, so you group people together by values, and you could cover the things you care about covering and not cover the things you don't care to cover. Other things that are cheaper, pre-existing coverage. So the ACA requires insurance to cover pre-existing conditions. This is a nonsense requirement for insurance. But within the broad scope of the ACA, it is a trade-off that makes some sense. So leaving the politics aside, it is a fact that it's there. Why is this driving up costs? Well, this means that if you don't pay your premiums for the end of the year, I mean, let's say you quit paying in November or something, and you get this, you get sick in December, tough it out till January, buy yourself a new insurance policy, and if you make it till January, you're good to go. This is absolutely not medical advice, not legal advice, not moral advice, not financial advice. If I'm going to advise you on this, don't do that. Pay for being covered all the time. But you could do it, and some people do. And that drives up the premiums for everybody who does not go this way. Health shares are exempt from this requirement. I'm not sure why, but I'm glad they are. So health shares don't have to pay for covering things that they were not paid to cover. Actually, they go even farther. In my experience, you start paying in January, for instance, and you won't be covered for new visits until like February or March or whatever. There's this lag built in. They do have an exemption to that lag for emergencies that come up. And I actually had to use that. My son got sick. We went to the doctor, and it was all taken care of because it was an emergency. But yeah, that was in that lag period. Another way they're cheaper. I don't know if this is just me that it works on, but I hope it's everybody. Health shares, they do what they can to make you feel like you're part of a group. So you are paying into a pool of people that hold your values and for the good of that group. When I buy insurance, I feel like I'm buying a product, and then I have no hesitation to limit my use of it, once I go past that deductible for the year. When I pay into my health share, that money isn't going to some financial company. It's going to pay for the medicine of other people. And when I incur an expense, I am taking that money not out of the pockets of some giant company that I don't care about, but from the families just like mine that paid into it. Because I treat it that way, I feel almost like I'm spending my own family's money. It does make me think twice and probably be a little bit more restrained with billing them. As far as the mechanics go, I'm not going to get too nitty or gritty, but from your perspective, it looks a lot like health insurance. You contribute monthly, you get a card that looks like an insurance card for billing, and so you go to the doctor and you give them the card, and that's that. Then they bill the health share, and then the health share will bill you for whatever is not covered by them. That being said, if there's any huge drawback, sometimes you get spurned. So like you go to the doctor and they're seeing this new card from this company they've never heard of, and they're a little bit difficult. Maybe they want to call them or something. But worst case, you pay for the services in cash up front, and then you just submit the bill and get reimbursed later. There's no 1095B, so when you're filing your taxes, they don't send you anything. You submit an 8965, which is health coverage exemptions. You get this from the IRS's website. And your contributions, they're tax deductible, just like if it was health insurance premiums. Is a health share right for you? Does your employer provide insurance for free or with heavy subsidies? If the answer is yes, then you probably shouldn't get one. I'm paying about $400 per month. If your employer is already doing that for you, and you can't negotiate that into giving you cash, then just take what you already have. Additionally, I got to deal with that burden of being the weird guy when I go to the doctor, especially to a new place. If on the other hand, if you're buying through the ACA exchange, you are probably way better off with this. My family is coming off of employer-provided health insurance. We started by looking at the exchanges. So we were looking at prices around $1,000 per month with deductibles that were thousands of dollars per year. With the health shares, we're looking at monthly contributions that are about half of that, and then the annual unshared amount way, way less, like an order of magnitude cheaper. In our state, with our local providers, the networks would not have been a problem. We would have had Blue Cross coverage specifically if we went with the exchange insurance, and it would have been easy. So in that case, that would have been an improvement with the insurance. But that would have cost us about $8,000 more this year. I was very happy to trade, 10 minutes of annoyance a few times a year for $8,000. So if you got to buy on your own, you're probably better off going with the health share. I hope this video helps. I'd really love to see healthcare sharing ministries take off and become the dominant form of healthcare coverage. But more urgently, I'd like people that don't have employer-covered insurance to know about another way. So if this is you, or if you know anyone that this might apply to, please tell them there's this option out there. I'm strongly endorsing the concept, but please, please, please do not take this as a recommendation or an endorsement of any particular ministry. I've only researched a few, and I've only personally dealt with one. If you have any experience with a healthcare sharing ministry, good, bad, or horrific, or fun, whatever, please comment below. I'd really appreciate you sharing.